Hey, Representative, I think I started the day when we took roll by saying today, October 27th, is actually National Cranky Coworker Day. I think some of us are getting cranky here, but I wanted to clarify a couple things you stated. I think you stated that the medical community is clear on these issues. Is that correct? Earlier?
On mitigations?
Yes.
Pretty clear.
Okay. What does the CDC recommend on masking? I might know a little bit about masking, by the way. I get lots of emails on it. Some of them aren't too happy with me, but what does the CDC recommend on masking? Ages 2 and up, right?
Yes.
Okay, what does the World Health Organization recommend on masking?
I'm assuming the same.
No, they're not. It's 12 and up. Other countries, if you've had COVID, you get 1 shot. In our country, if you're 12, you get 2 shots. Other countries for kids, they're doing 1 shot.
I don't know which vaccines they're using in other countries.
Well, they're using Pfizer. They're using some of them. But the point is pretty clear. We can simply go back to the masks, that the medical community is anything but clear on this issue. Let me ask you another question.
In this country,
Do you think a 6-year-old is better served by getting COVID naturally when they're much less at risk at it, as opposed to getting a vaccine and not getting the full immunity for it that might affect them for the rest of their life? How do you feel on that?
I'm not a doctor.
You're right, and we're voting on this bill. I'm going to go to the bill. The medical community is anything but clear on this. This isn't about this bill. There were 50,000 witness slips filed because we haven't done our job for 20 months debating all these nuances. I talked about it in a press conference last week. My wife teaches a kindergartner that's forced to wear a mask that has autism, and it is not in the best interest for that child in that situation to be wearing that. But we have refused for nearly 2 years to do our jobs. Things aren't black and white, and people back home are hanging on to this bill. They're hanging on to this act because we're not acting. They can't come to us. You guys have to say the same thing. Well, you know, it's the governor's executive order. We're not debating it. That's what this is about. The people that are upset at school board meetings, the people that file the witness slips, the people that are going into places that I wouldn't go would be less upset if their legislators, the people whose office they can go into and talk to, were actually having very clear debates on these nuanced situations. But we want to do a one-size-fits-all, and this is the last hope they have. Let's not take that last hope that these people have, and let's vote no on this bill. Thank you.